there's a bit of an adjustment period. It's certainly very different to being on Earth, at the very least. Okay, I do believe we shall jump right into our session today. Today, I believe I'm going to be doing an ear exam on you, examining your ears. I did notice when I saw you last that you had a little bit of a build-up of earwax in there. So I'll confirm today whether or not that needs to be addressed. I can do a quick ear cleaning for you if that is the case, and that won't take long at all. Okay, so first thing, I'm just going to pop on some gloves for hygiene purposes, of course. Difficult to get on, aren't they? I have to order a slightly bigger size. Perhaps my hands have grown since I last tried to wear these gloves. feeling in all the areas of the outer ear, sharp or soft. is I'm going to wiggle my fingers and I'm going to move them away from your ears. And I want you to tell me when you can no longer hear them. Okay, so we're going to start that test now. Good. Doing just the one ear now. Good. Good. I just want to do both ears one more time. And there we go. Very good. Okay, and now I'm just going to be clicking my pen around your head, and I want you to tell me, please, left or right. What side is it coming from? Okay, so if you could close your eyes for this one, please. Very good. 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 Very good. Okay. What I need to do before I begin physically cleaning your ears is I need to put a little bit of liquid solution into your ears, okay? And this is going to help soften the wax, and it's going to make it a lot easier for me to remove the wax from your ears, okay? It's going to dissolve and break it down prematurely for me. Just need to shake up the solution a little bit before I apply it. Okay, that should be enough. That should be enough. If you could tilt your head to the side for me, please, just like that. Very good. Just going to pour a little bit of the liquid, into that ear. Just wait a couple of seconds. Very good. Now if you could tilt your head to the other side for me, please. Just tilt this up a little bit, sorry. Okay. Okay. Let's pop this in that ear. Okay, just a little bit in that ear, just a little bit. Just a little bit in there. Okay, very good, very good. Marvelous. Okay, just stay like that for another couple of seconds for me. Very good. Now you can pop your head upright, nice and straight, just like that for me. Okay. That solution actually needs just a short period of time, maybe a minute maximum, to activate, okay, to dissolve the earwax and to soften it up for me. So in the meantime, I'm just going to make a few notes here about what I've seen today, and I'm going to update your medical file information, okay, whilst we wait for the solution to activate. Okay. ear to have settled and activated in your ears. So I think everything is okay. I think we are ready to begin the ear cleaning now. Okay, so I am going to just be using cotton buds primarily to clean your ear today. A very, very gentle procedure. I'm just going to be looking in particular the outer ear canal. I'm going to be going too deep at all today, so it shouldn't be painful for you at all. Shouldn't be too uncomfortable either. Just let me know if you do need a break or anything like that, okay? But otherwise, I'm just gonna give your ears a bit of a clean neck. Everything's okay? Yeah? Very good. Okay, I'm just going to be going a little bit deeper into the ear canal now. Not too deep, nothing too crazy today. The earwax buildup that you have is not that bad, okay? But this will sound more intense, of course, because I am getting a little bit closer to the eardrum now, so it's going to sound louder and probably feel more intense as a result. Okay, so here we go. necessary, and it could even be a bad thing, technically.